Hi, this is Aaron with Aaron Cook Insurance, and this is part two of Navigating Medicare 2025. In part one, we talked a little bit about what Medicare was, what it wasn't, and what it did and did not cover. We also looked at what some of the costs that you might face could be with the holes in original Medicare. In part two, we're going to talk about where you can find additional coverage to help fill those gaps and those holes. Generally, there are two main options for more coverage. Option one is to remain on original Medicare and add on to that a Medicare Part D prescription drug plan to help cover your prescription drug cost, as well as a Medigap plan. Medicare supplemental insurance, or Medigap, helps cover some of those out-of-pocket costs that are not paid for by original Medicare. The second option is to enroll in a Medicare Advantage plan. Medicare Advantage, or Part C plans, combine all the benefits of A and B into one plan. They usually also include prescription drug coverage, and many offer additional ancillary benefits like dental vision. It's important to remember that Part C Medicare Advantage plans are an alternative to original Medicare. While plan members are still in the Medicare program, their benefits are administered by the insurance company that enrolled them on that plan. These insurance companies have a lot of leeway in determining where and how benefits are given. Again, many plans do offer that built-in prescription drug coverage, and they have additional health benefits like dental, vision, and fitness programs. By law, all Medicare Advantage plans are required to provide the same level of coverage that would normally be given by Medicare Part A and Medicare Part B. The addition of prescription drugs or prescription drug coverage, dental, vision, and hearing insurance, as well as having fitness programs and other memberships added on, is a benefit to a lot of people. One of the nice things about having everything bundled together is you only have to worry about one insurance card instead of needing to keep track of both your Medicare card and a supplemental insurance card and a dental insurance card. You just have one convenient card to give to your doctor. All Medicare Part C Advantage type or plans will fall under one of the following plan types. The two that we should focus on are going to be underneath the coordinated care plans. The Health Maintenance Organization, or HMO, and the Preferred Provider Organization, PPO, are the most common. Typically speaking, the HMO is going to be a smaller network that is centered around a hospital or hospital group. Plan members on an HMO are going to be required to have a general practitioner. This general practitioner doctor is going to help coordinate all your health care. They're going to determine the specialists that you need, and they're going to make recommendations to the plan that you go see certain specialists. It's important to make sure that you both like your general practitioner and that you're comfortable with the specialist in this network. When you're on an HMO, you do not have the flexibility of going outside of the network to seek care. If you do, your insurance plan will not pay, and you will be stuck with the out-of-pocket costs. Under a preferred provider organization, or a PPO, you have a bit more flexibility. You're not required to have a GCP. And additionally, you can seek care out of network. Although if you do, you will most likely have a higher cost. For example, in network, going to see a specialist might be a $25 copay. Whereas if you go out of network to see the same specialist, it might be a 40% coinsurance. The other two types of plans that I want to talk about are going to be underneath the special needs plans, or the SNPs. Special need plans, specifically the dual special needs, or DSNP, and the chronic special needs, or CSNP, are designed for people with the special needs. Dual special needs is for people that is on Medicare and Medicaid. There are different levels of eligibility underneath DSNP, and your agent or broker will be able to help determine what level of eligibility you have when picking a plan out. The chronic special needs, or CSNPs, are designed for people that have serious health problems. The most common that I see are going to be people that have heart problems or that have long-term diabetes problems. CSNP plans typically have a very robust drug plan added on to help pay the cost for a lot of the medications that their beneficiaries need to take. To be enrolled in a Medicare Advantage plan, you must be enrolled in both Part A and Part B and live in the plan's service area. You cannot be denied coverage based on a current financial or health status, including pre-existing conditions. You may be required to use a provider and pharmacy networks. The coverage and costs vary by plan and may change every year. All Medicare Part C plans have an out-of-pocket cost for covered services, and this is a limit you will not pay more than every single year. For 2025, the out-of-pocket max is around $8,000. No plan will require you to pay more than $8,000. Some plans do charge a monthly plan premium, although most plans can be found for around $0 to $10, depending on the benefits that you'd like. When you're enrolled in a Part C Medicare Advantage plan, you must continue to pay your Part B premium to Medicare. Medicare supplemental insurance, or a Medigap plan, is the other way that we can help cover our out-of-pocket costs not paid for by Medicare Parts A and B. A Medigap plan works with Original Medicare and our Medicare Part D plan. You may not use a Medigap plan to pay for the cost of a Medicare Advantage plan. You may not have a Medigap plan and a Medicare Advantage plan at the same time. There are a total of 10 standardized plans. These plans are the same across the country, and they're labeled by letters. Plan A, Plan G, N, and F are common. The services and cost do vary by plan. However, everything that is with the same plan letter will offer the same. For example, a Plan G in Oregon is going to offer the exact same benefits as the Plan G in Florida. There are three exceptions to this, in that Massachusetts, Minnesota, and Wisconsin do standardize their plans differently. Depending on the Medigap plan you have, your plan may help cover your Part A hospital coinsurance, your Part B coinsurance, as well as copays, Part A skilled nursing facility care coinsurance, or your Part A and Part B deductibles. All plans provide an extra 365 hospital days, as well as the hospice care coinsurance and the first 3 pints of the blood cost underneath your Part A. Foreign travel for emergency care is offered on few of the plans. However, it's typically only after a $250 deductible. No Medigap plans cover prescription drugs, dental, vision, or hearing care. Also, custodial care and long-term care are still on you. Medicare does not cover these in general. For those of you that have received your Medicare and You handbook, on page 77, you'll see this chart. These are the standardized Medicare supplement plans that are offered nationwide. Take note that on the right-hand side, you'll see plans C and Plan F. These two plans are only available to people that were first eligible for Medicare prior to January 1st, 2020. The other plans are available to everyone else. Plans G and Plan F also have high deductible versions. The high deductible versions offer the same level of benefits. You just have a higher out-of-pocket cost up front. Regarding Medigap plans, you must be enrolled in both Medicare Part A and Part B and live in the state where the plan is offered. Coverage is nationwide and there are no provider networks. Unlike with the Part C plan, you don't need a referral to see a specialist, and you can see any doctor you want and the plan will still cover everything the plan normally would. You are guaranteed renewable if you pay your premium. This means that if you happen to get sick, the insurance company can't kick you off so long as you continue to pay. Your plan premiums will vary for coverage, and typically the plans that have more coverage have higher premiums. Additionally, you may be required to continue to pay your Part B premium to Medicare. Most importantly, Medigap plans are allowed to go through medical underwriting. This means that the insurance company selling you that plan is allowed to look at your health history and potentially charge you more. Or they could even tell you no, they don't want to insure you and deny you coverage. The exception to this is when you first turn 65. You have a 6-month window after enrolling in Part B for the first time where you cannot be denied coverage. You will not have to go through any medical underwriting. You're the first time that you try and buy this plan at that age. Part D prescription drug coverage. There are two ways to obtain this Part D plans. The first is a standalone Part D plan, and this is most often done when you have a Medigap plan. The second is a Medicare Advantage plan that includes prescription drug coverage. There are benefits to both of these. Perhaps you really enjoy the Medicare Advantage plan that you're looking at, but you don't like the drug coverage. Unfortunately, to enroll in a certain Medicare Advantage plan, you have to take that drug coverage that's bundled with it. You may not get a separate one and almost mix and match. With a Medigap plan, you can pick any standalone Part D plan that's offered in your area. All Medicare Part D plans cover the types of drugs that are most often prescribed for Medicare beneficiaries as determined by federal standards. Specific brand names, drugs, and generic drugs are included on a drug list called a formulary. All companies have a different formulary, and very rarely are two the same, even within the same company. Some of the vaccines that are not covered by Medicare Part A or Part B are covered under your Part D prescription drug coverage as well. The formulary is just a fancy name for a list of prescription drug covered by that plan. The drugs are grouped into tiers based on their cost, and in general, the lower the tier, the lower the cost. Your deductible may be charged by tier. During the year, you're going to go through different drug coverage stages. The first is when you very first start of the year, you're going to have your annual deductible, and you are going to pay that up to the plan deductible. Not all plans have a deductible, and sometimes the deductibles are only applied to certain drugs. It's important to note that if you are on a Medigap plan, if you are on a Part C plan, your drug coverage deductible is not the same as your Part C plan deductible. They are separate. After you've met your deductible, you're going to move into the initial coverage phase. For 2025, the max out-of-pocket cost is going to be $2,000 total. Once you've paid this $2,000, you're going to move into the catastrophic coverage phase. From this point until the end of the year, your insurance company will cover the total cost of all of your drugs, and you will not be required to pay any more. In 2022, the Inflation Reduction Act was signed, and it brought a couple of important changes for 2025 Part D prescription drug plans. Specifically, the out-of-pocket costs are now capped at $2,000. In 2024, the total out-of-pocket cost for beneficiaries was $3,033. The Part D deductible has also changed. It now has a limit of $590. This is up from $545 in 2024. The coverage gap, or the donut hole, has been removed. Finally, the Medicare prescription payment plan allows beneficiaries to pay out-of-pocket prescription drug costs in the form of capped monthly payments instead of all at once at the pharmacy. Let's look at an example of how that would work. Let's say it's January 1st and you walk into your CVS pharmacy and you need to fill your Ozempic. This is typically a very high-cost prescription. You're going to pay potentially the first $590 up front, and that's your deductible. And you've met that deductible on day one. However, you still have a $610 bill that you owe the pharmacy, and that's going to be part of your out-of-pocket cost. Maybe you can't afford to pay all of this at once. What you can do is you can ask to be enrolled in the Medicare prescription payment plan. The pharmacy will give you a piece of paper to fill out. Once signed, that paper will go back to your insurance company. Instead of paying that cost up front at the pharmacy, the insurance company will bill you the total $610 over the course of the next 12 months. This allows you to smooth those costs out for a more regulated payment plan as opposed to a really expensive one-time out-of-pocket purchase. To be enrolled in a prescription drug coverage plan, beneficiaries must be enrolled in both Medicare or Part A and Part B. You may be required to use a pharmacy network. Your coverage and costs do vary by plan and may change each year. There is a penalty if you enroll late on a Part D plan. The exception to this is if you qualify for a special enrollment period or through certain federal programs. Finally, not everyone needs a Part D plan. Some beneficiaries can receive drug coverage elsewhere, such as TRICARE for Life or through the VA.